Welcome to Let's Talk. Our session today, Increasing QRIS Awareness and Participation Through Strategic Communications. I'm Deb Mathias from the BUILD Initiative and the director of the QRIS National Learning Network. Before we begin our session, I'd like to thank the Alliance for Early Success and other generous funders for making this learning community possible. We began this series for state quality administrators and leaders to support their essential work within states around early learning systems building. We have colleagues registered from over 24 states and territories. We intentionally keep the sessions small to invite conversation and sharing. We hope these calls enable us to illuminate challenges, innovation, and promising practices. I'd like to say what we've done, the cross-sector QRIS tool that BUILD published a couple of years ago with over, 21 states now. And each time we complete that tools, a majority of the states highlight communication and outreach as an issue that they want to work on more, think about more deeply, and that they're challenged with. So this topic today is really a very important one for state leaders, whether you're thinking about communication in order to reach families, providers, stakeholders in general. A number of you, when you signed up, said, of course, the main things that you were looking for was how to approach those unique audiences, on strategies that have worked for other states, freshen up your ideas, and hear about a successful state that's implementing well. One of the interesting things someone said when they signed up was about strategies for communicating QRIS impacts specifically around infants and toddlers and an environment that can seem at times more preschool centric. So we'll work to get to that question along the way. But right now I'd like to, without further ado, sincerely thank our session contributors, Mindy Binderman, who's the Executive Director of GEEARS, Georgia Early Education Alliance for Ready Students. Mindy's the founding Executive Director for GEEARS, and she leads GEEARS efforts to inspire and provide leadership for a statewide movement on early learning and healthy development for children aged birth to 5. Vet Vandiver is the Director of Communications for GEEARS. Vet leads the communication and public awareness efforts for the organization. She was born and raised in Georgia and is passionate about increasing awareness for early education in the state. She has a variety of experience in strategic communications, public engagement, digital communications, and photography in both the government and non-private sectors. We're so looking forward to hear what you folks have to say about this topic and learn from your very interesting experiences in Georgia. Mindy?
Thanks, Debbie. We are really looking forward to today and presenting all of the great things we've done with our quality rating and improvement awareness and engagement campaign. I just wanted to start next with a just an overview of the presentation that we'll be providing. You can go to the next slide. I'm just going to talk for a little minute about GEEARS and the timeline, how we got involved in this campaign. Really, the bulk of this presentation is going to be about an overview of the steps of the campaign and our strategies, as well as we want to share with you some of the most recent campaign work that we've done, and then talk about how we've evaluated it and any questions that you might have. So next, you can go to the next slide, and then the next slide. Next slide. GEEARS is a nonprofit that was established 9 years ago now by the United Way of Greater Atlanta. We were really established to be a voice throughout the state to create a movement for children birth to 5. The United Way had found that there were lots of organizations working on early education, but not one that focused just on advocacy, policy, research, and public awareness building, and only for kids birth to 5. And so that's what GEEARS has become through the years. We work to help the business community, the civic community, government leaders, and others maximize the economic investment on the economic return on the state's investments in early care and learning. And we work to support high quality early learning and healthy development for children aged birth to 5. You can go to the next 2 slides, yeah. So the campaign timeline is important. You'll see that we were established in 2010, right at the beginning of a gubernatorial election. And so Governor Dill, who was our most recent past governor for 8 years, was elected in 2010 and began in 2011. One of the commitments that he made to Georgia was to start a quality rating and improvement system. At the same time, GEEARS had just been established, and we were, one of our charges was to work with the state on a quality rating and improvement system. So from the very beginning, we were partnered with our State Department of Early Care and Learning on this work. As we worked together, we realized that one of the things that GEEARS could do best was lead the public awareness campaign and really begin to build consumer demand for such a program. And so that's what we started. In 2013, Georgia received the Race to the Top Early Learning Challenge grant that accelerated our quality rated work. And we worked together to do private fundraising as well. I don't know if we talk about it anywhere else, but we raised to date about $18 million to support the quality rating and improvement campaign. In addition, we've gotten grants from the Kellogg Foundation, from the Whitehead Foundation. We got an in-kind investment from the Cox Foundation, and we used some Race to the Top Early Learning Challenge dollars for this campaign. So it has been a real partnership, and that'll talk about how the role that GEEARS has played, but also the role that our Department of Early Care and Learning has played in this work. So Vet.
Great. So this next section, we're going to explain some of our campaign steps and strategies. So you can go to the next 2 slides. And the next one. So the first step that we like to share with people is research and focus groups. You can go to the next slide. So the initial research took place back in 2015. And Mindy might be able to share if things happened even before then, but it started with some surveys of parents, and we did telephone surveys as well as focus groups in Metro Atlanta, but also in other parts of the state like South Georgia and Central Georgia. And some of the things that we found were that parents didn't have a lot of knowledge or awareness of our QRIS, and a lot of people had never heard of it or weren't aware of the importance of it. And a lot of families who had used the system felt that it was overwhelming or confusing. So after that, we did another survey in 2017. And if you go to the next slide, you'll see some of those results. So one of the things we talked to parents about were if they'd used some sort of program for their children that were ages 5 or younger, and we learned a lot that really helped inform our campaign plan. So one of the things that we learned was that a lot of parents did have their children in some sort of program, but that many other parents were seeking nannies or babysitters. And a lot of parents also use center-based programs. So this was really helpful just as we were going about planning, but also really understanding our target audience for this campaign. And if you go to the next slide, you'll see another question. So when we ask parents how are they finding and making decisions about childcare, the top selection both in 2015 and in 2017 was from other family members and from friends. So we also learned that parents talk to other parents when they're making these decisions about childcare, and they listen to other schools that are in their area. So if you go to the next step, we talked about selecting a measurement tool and our goals for the campaign. And this has been really important, and we've seen how critical it was that we set this up in the beginning, because that's how we've described our success since then. And it's important not only for grant reporting, but also when we're sharing this information with our partners in the state, but also other partners around the nation like you. And so if you go to the next slide, you'll see our framework for measurement. So when we were talking about measuring our success, we looked at the activity, meaning the number of campaign outputs that we had each month. What were we doing for the campaign? What projects, what initiatives do we have going on? Also looking at the awareness of our audience, which has been families primarily. We also looked at engagement rates. So figuring out how our audience is connected to our campaign work, and that's not just digital engagement, but also when we're hosting events and what providers are hearing from parents. Another thing we measured was the sentiment of the campaign, and if families are feeling positive or negative about quality rated. We also looked at advocacy, and if our key groups and our influencers were promoting us in the way that we wanted to be promoted. And lastly, we looked at the conversion. So how many people have been using the tool, which for us is our quality rated website. And we measure our website use and the clicks that happen on our website every single month. You can go to the next slide. The next step is really deciding on your desired brand and imaging and messaging. And if you'll go to the next slide, you'll see some images of some familiar people. So this was an exercise that some of our state partners, as well as us, did before deciding on what we really wanted our brand to represent. And so when we asked our partners, what do you see or what do you think of when you think of quality rated? Some people said Michelle Obama, thinking about someone who invests in their community, someone who's a great communicator, someone with high standards. Someone else said Miss Honey from the movie Matilda, because she's warm and friendly and she represents quality without judgment. And someone else said Mr. Rogers, because he's caring, wise, and fully invested in children's educational and emotional needs. So when we thought about our brand, we thought about what it would represent and what we wanted quality rated to represent. You can go to the next slide. So if you're thinking about this, some questions that you can answer are on the screen, and I won't read all of them, but they're all very important when you're thinking about this step in the campaign, especially the current perceptions and reputations of your QRIS. Some of our current perceptions were that people were just confused by the rating system or even understanding what it was. And so once we started explaining it in a way that made sense for families, like how hotels and restaurants are rated, and that's important, and you want to know the rating for your hotel or for your restaurant, in the same way that you would want to know the rating for your child's child care program, people started to understand it. Can you go to the next slide? So these are two different logos. These were our final two options when we were creating our logo. And you can see they look very similar, except for the logo on the right has the green font for childcare. And this seems very small, but it made a huge difference for families who had a perception that green meant good and therefore something positive. And so that's why we went with this green version of the logo.
I should also say that when we first did the logo, we did not have the words childcare. We just said quality rated, assuming that the rest of the materials would explain to families what that meant. As we did more research, we realized that families had no idea what we were talking about. Was it quality rated TV? Was it quality, you know, they had no idea. So we added the words childcare to the bottom, which also made a tremendous difference.
Absolutely. If you go to the next few slides, Jonathan, we'll just briefly explain a little bit about Georgia's QRIS. It is called Quality Rated Childcare. You can go to the next slide. And Quality Rated is a free online tool where Georgia parents and families can find information on quality child care programs in their area that have been evaluated by independent experts, regardless of what type of program they prefer, whether at home, a preschool, at a center, or a program at a school. And we put that entire block of text on there because that's the messaging that we use when we're describing quality rated to families. It's been very important for us to have a consistent message, but also to have something that we can look at when we want to remember how we're supposed to describe quality rated and what it's supposed to represent. You can go to the next slide. This next slide is a screenshot of the quality rated landing page. So when you go to qualityrated.org, this is what you'll see, and this is what families see, so they can immediately start their search for childcare. We have a brief description at the top, and that search tool is right there on the middle of the page. You can go to the next slide. This is one screenshot example of what search results might look like. Families can search for childcare, something that's close to their home or their job, and they can also search along their route and their commute to work, and that's a newer addition to the tool. But you'll see this map that's similar to a Google Maps display, and that's how families can see based on the map or on a list that's shown on the bottom. So if you go to this next slide, this is the PSA that we had created, and it is a brief video, so we'll play this.
Kids. We may never figure them out. But finding quality childcare doesn't have to be a mystery. Quality Rated Childcare is a tool that rates Georgia programs so you can feel more confident about your choice. Visit qualityrated.org.
So the very end of the PSA shows a computer typing in qualityrated.org, and then it has that tagline to visit the website, and I don't think it played on our end, but that's just so you guys know. And part of that video in the creation was creating the messaging that was really informed by those focus groups that we did years ago. And the tagline for this campaign has been, "Kids are a mystery, but finding quality childcare shouldn't be." And so that's the tagline that rings true throughout this PSA video. We've also created an audio version that's been played on radio stations around the state. And the children that you saw in this PSA video, we captured some photos of them during that filming process, and those photos have been used on campaign materials. So Jonathan, if you'll click through the next few slides, people can see some of those. And I just want to stop briefly on the last image, just for kind of a lesson learned that we had when sharing some of these photos. This particular image was a billboard that was a couple of places around the state, and we had a couple of people that did complain about the billboard, just finding it inappropriate. So that's something that maybe when we were filming didn't think about could even be an issue.
The fact that there was child nudity was what they found inappropriate about this particular image.
But the rest of the images have been really well received, and we've used them over and over again for years, which a lot of times images run out of their use after about a year, but these have had a really long shelf life. So I think if you have quality images in a really quality PSA or filming, you can use the outcomes for quite some time. And you can go to the next few slides just so people can see what some of those advertisements look like. These are examples. And this next slide is actually an example of stock photography. So I know that creating original photos and doing a video shoot isn't always an affordable option. So purchasing stock photography and licensing it is another option that's more affordable. And you can see these are still great photos that we've used in our campaign. And you can go to the next slide. And these are just a few of the social media posts that we used along with the images and the PSA. Just wanted you to see some examples of what that looks like. And you can go to the next slide. So the next step in this is to really engage and encourage providers, not only about the importance of participating in the program, but helping them to understand how parents are appreciating and demanding quality when it comes to childcare. And you can go to the next slide. So these are two examples of some of the things that our state partners have done just to recognize providers that are participating. You can see when there was the 1,000th provider participating, they were recognized on social media, and I believe there was also some sort of celebration for them at their center. And also on the right, you can see every month our state partners share what providers have increased their rating or have become recently rated. And you can go to the next slide. During this campaign, we've been sure to engage providers on the materials that we're creating and the resources that we have available to them, because we want providers to also be stakeholders and be spokespeople for this campaign and feel confident to speak about quality rated. And you can go to the next one. So step 5 is media outreach. And you may think, why are we engaging the media on this type of campaign? But our media outreach has been a pivotal part of the work that we've done over the years. And if you go to the next slide, we have just a couple examples of what's been done. In 2016, in Central Georgia, a local station covered a child care program that was there, and just congratulating them on becoming quality rated. And they also shared what other programs in the region were quality rated. That image below is from one of Atlanta's top news stations, where people from GEEARS, our office, have done 2 different interviews with their team, sharing information about quality rated, sharing what the tool includes and why it's so important to families. We've also had some op-ed placements from business leaders and community leaders on this issue. And the image on the right are just 2 different spadias that were done about quality rated, and this is part of that in-kind advertising that we received that Mindy mentioned earlier.
And a spadia, for those of you who still get a paper newspaper, it's basically the wrap, as it says on the slide, that goes around usually the Sunday paper. And so it was on every Sunday paper on a couple of days in November of 2017 and March of 2019.
Yeah, and we also had probably 15 to 20 different advertisements within the actual paper and on the digital version. And this is Atlanta's top paper in terms of the media placement. So step 6 is digital and paid advertising. You can go to the next slide. And the one after that. So a big piece of this campaign has been using Google AdWords and Facebook advertising. And this is what was done back in 2017 when we worked with a national firm to really help us place these advertisements. But now Google has a lot of resources available to where they can help you place advertisements on the right website so that people are seeing your ads and you're getting the most for your money. And so we really measure the pay-per-clicks, and those pay-per-clicks at one time were driving 70% of our website traffic for every month. So that was a huge piece of the campaign work that we were doing, but we understood that that wasn't sustainable because we couldn't keep paying for advertisements every single month. And you can go to this next slide. And this is kind of a teaser for some of the slides that are coming up. But in 2017, July of 2017, we had around 10,100 users that visited the Quality Rated website. And in July of this year, we had more than 201,000 users visit that same website. And so we'll be sharing more on what's happened in between that time. You can go to the next slide. So I mentioned that we had billboards around the state, and the PSA video that you saw earlier played more than 860 times on TV in both English and Spanish. We also had that play on radio stations around the state in English and Spanish. And the value for all of those PSAs and the playtime was close to $1 million, but all of that was in kind. Go to the next slide.
We also work a lot on community outreach, and you'll hear that partnerships here are really important. Georgia's a big state, and we try to reach all of it in different ways with a combination of earned media, social media, but also just showing up. So if you go to the net, and in the very early days, we held receptions for providers just to get them excited about what Quality Rated was. It's a voluntary system, and we needed them to enroll. We often had peer ambassadors at those events as well. But then as things moved forward and as we had more and more providers who were actually participating and even quality rated, we knew we needed to reach out to families. One of the things we did was, and continue to do, is try to reach out in big events. One example was the Atlanta Baby and Child Expo in 2016. We purchased actually a sponsorship for that. We got a great booth. We had lots of collateral advertising as a result of the sponsorship. About 800 people attended. All of them stopped at the quality rated booth, and they got lots of great giveaways. And at the time, at least 17 parent and family blog posts promoted the event and featured the quality rated logo. So it was a great way to get some pretty intense high-level visibility. In addition, we do tabling kind of all over the place through our parent ambassadors who share quality rated materials at health fairs, at kind of back to school events. Any opportunity we have to share quality rated information is important. We also have a parent ambassador program that's run by our CCR&R. And we work with that we work with our CCR&R and their ambassadors, and they've identified key parents and families, as well as quality rated providers who serve as spokespeople for the campaign. And we share resources with them. We work with the state to communicate about quality to families in a whole lot of different ways. We we really talk about the fact that a center or a program that is quality rated has committed to quality. That's because in Georgia, and many of you might not realize this, our quality rating improvement program, you don't get any stars just for licensure. You have to be licensed just to participate in the quality rating and improvement program. So we really do work hard to explain that the programs that have voluntarily committed to participate are already committed to quality, and we think that's pretty important.
And you can go to the next slide just to see an example of the ambassadors that Mindy was just speaking about. And I'll speak about this next section, step number 8. So you can go to the next slide. So this has been the biggest piece of the recent part of our campaign, really building new spokespeople and working with influencers to share this message about the importance of quality and helping families understand quality rated. You can go to the next slide. These next few slides, I'll be using some of these words. So if you're not aware of what they mean, just very quickly, when I'm talking about engagement, talking about people commenting, liking, sharing things on social media. When I'm talking about reach, that means the number of people who have been exposed to the post. Engagement rate, see there how it's defined precisely, but it's really how many people are interacting with the post. And impressions, how many people are seeing it. They may not interact with it, but it does come across their screen, they're sliding down their phone. In a post, when I say post, I mean an Instagram post or a blog post, but I'll try to specify. And media value is really just calculating how much value it comes from these posts that we've gotten from social media influencers. You can go to the next slide. So at the start of 2018, we hired a local firm that really specializes in influencer marketing and social media marketing to work with us on this phase of the campaign. And they work with a network of bloggers and influential people in terms of social media. And we specifically wanted access to their influencers who had young children or who could speak to trying to find childcare. So on the screen right now, we have a couple of the focus group participants because the first piece of this part of the campaign was hosting focus groups with these influencers to understand what they knew about childcare, if they had heard about quality rated, and what their thoughts and perceptions were on childcare in Georgia. You can go to the next slide. So this is just a list of some of the people that we have used in terms of influencers. We've worked with over 35 people total, but these are some of the influencers from one phase of that campaign. And we really had to work hard to find a diverse set of influencers, in diversity in terms of racial backgrounds, in terms of knowledge of the campaign and childcare, in terms of the ages of their children, their geographic locations, and education. So our influencers were selected on these different criteria, and we worked with our state partners to select them. You can go to the next slide. So we did 3 different campaigns with the influencers, and all of them were extremely successful. These are the campaign outcomes just from this first phase that we did. So you can see on Facebook, we had over 65,000 different impressions. We also shared their posts on Pinterest and Instagram stories. And you can see Instagram stories had over 3.5 million impressions. You can go to the next slide. These are other key indicators that we use when measuring our performance for the influencer campaign. We looked at the increase in impressions for quality rated social media channels, and you can see that all of the channels did increase their impressions and followership through this campaign. And so by families seeing these influencers post, they were prompted to follow quality rated and learn more about what we're sharing. You can go to the next slide. So we wanted to share what one of these Instagram posts might look like. This is one of the influencers that we worked with, and she talks about how being a working mom is hard and all the things that she's doing. So that's sharing a personal tidbit, and then she gets into quality rated. And you can see we pulled out some of the comments that people left, just sharing things about how their child might go to a quality rated program and the different things that moms are experiencing, but that's the type of engagement that we want. You can go to the next slide. All of the influencers did Instagram posts and Twitter posts, and they also wrote a blog post. And the blog posts are really what was important for us, because when people are searching online on Google and they type in quality rated, they might end up on one of these blog posts just because the influencers have such a high readership. And so we want them to end up on the blog post, read about their experience, and then be prompted to the quality rated website. So the quality rated website and information on the system was included in all of these posts. And again, we worked with our state partners to approve all of these posts before they were live. You can go to the next slide. So overall, all 3 phases of the influencer campaign were very successful, and we saw over 5.2 million impressions generated, and our engagement rates were extremely high, and we really were able to connect the influencers' posts and the Instagram views back to our website and see that people were finding qualityrated.org through these influencers. You can go to the next slide. So here I've just gathered the 8 steps because I know we just talked through a lot there, so you can see everything in order here as you're looking back on this. And you can go to the next slide. So this is the most recent phase of our campaign. Just this summer, we were very busy working on different quality rated initiatives, and I'll talk about a couple and then hand it back over to Mindy. So if you'll go to the next slide. Some of the things that happened this summer were creating more win signs for quality rated providers. We have this image here that you can see, and providers love these signs, and families do too, because you can see these as you're driving by. And it's something that providers are proud to have and proud to showcase. So we were able to purchase more of these for quality rated providers and for providers that are in the process of becoming rated.
In the early days of the campaign, we had big banners for providers, and they were really hard to hang. Providers didn't know what to do with them, and so based on a lot of provider feedback, we went to these win signs. But again, it's just one of those little lessons learned. We loved the great big banners, but when you can't hang them, it doesn't make any sense.
Another aspect of this summer's campaign has been sharing the bite-sized video series that we created. We worked with a really awesome video company to create a set of 8 different videos, and from those videos, they made us mini series of videos that are about 30 seconds or a minute long. And those are what we shared on social media throughout the summer. And I've grabbed a screenshot of one example that got, close to 50,000 different impressions just from sharing it on social media, and families love it. These are real people, real providers, real children who've given us permission to film them. So it's really exciting for families and providers to see themselves shared by Quality Rated. The other two examples are just radio advertising that we continued this summer, and we did a radio interview for a Spanish-speaking radio station, and the posters that we had created for the WIC clinics and the Georgia pediatrician offices around the state.
You can go to the next slide. Partnerships continue to be important, and as we want to sustain the campaign over time, as we have less funds to spend, we know we're going to need to do that with partners and with word of mouth. So this summer, we also hosted 2 events for business leaders and policymakers outside of Atlanta, really to get them to ensure that they're continuing to be excited about early care and education and Quality Rated, but so that the civic leaders can create their own demand that providers participate in Quality Rated, and that they learn how they can support the providers in their own neighborhoods and spread the word about Quality Rated. We had events in Columbus, Georgia, and in Athens, Georgia. In both places, we did them with local businesses. We had great legislative participation with city council people, county council people, mayors, state legislators from the various offices who came to those events, and it was pretty exciting. Both of those events included an update on the business case for early childhood. We shared information from our latest study that we call Opportunities Lost about economic impact of childcare, so that businesses understood what's important and what's in it for them. And then we ended with a tour in both cases of a Quality Rated center, so that they could see that for up close and personal. In addition, we had an event for Quality Rated families and social media influencers. It was really fun. We had photo booths, we had dinner, we had presentations. It was also really hard work, especially to follow up with the influencers. But we were so pleased that we had families come and have a great time, and influencers who experienced firsthand the personal stories of the families, and we saw immediate posts and from that as well. So that was it was not only fun, but it was a different way to engage the influencers.
And the families.
Or the families.
You can go to the next slide. You can go to the next one too. So we talked about the steps and strategies that we've taken and some of the work that we've done this summer, and we do measure our success using the website views and website engagement. But another thing that we look at is provider participation. And of course, our state partners are working on this every single day, but we have come to understand the importance of the public awareness campaign and how that builds demand from families to demand that quality from providers. And if their provider that they're using currently is not Quality Rated, and families are hearing about this through our social media pushes, through the PSA and everything else, it gives them the opportunity to ask their provider why they're not participating and challenge them to start participating. So as of August 15th, of the 4,661 eligible programs, 1,834 are rated. And these next few numbers kind of get into the details of the rating system. We use a 3-star rating system. And so 39% of those are star rated. 35% of those are somewhere in the process. So we refer to those as participating, but not necessarily rated. And 26% of those are not yet participating. You can go to the next slide. So this was just to show you a resource that we're really thankful to have. Our state partners do also show participation in Quality Rated by legislative district. So this has been helpful when we reach out to legislators. We can share our data and information on their districts, but we can also share this data on the Quality Rated participation and let them know who in their district is participating and who isn't, because again, it's great to have other spokespeople for this work.
We've seen, for example, state legislators who will put little blurbs in their newsletters encouraging families to seek out Quality Rated care, or encouraging the providers in their district to participate in Quality Rated.
And just another note on this and the different steps in the campaign, one thing that we'll talk more about in a minute when we discuss the evaluation is the importance of having quality rated programs available for families, because we know it doesn't make sense for us to encourage families to seek quality rated programs when there aren't any available where they live. So that's something that we've understood throughout this process and are continuing to understand and try to work with our state partners to make sure that we're all in alignment as we continue our progress on this work. You can go to the next slide.
In the last 2 years, we've worked with an evaluation firm called Civitas Strategies to evaluate the campaign. That's through our Kellogg grant. We got the ability to evaluate, and we were pretty excited with the results. It covered, for the most part, we had 2 evaluations, a formative and a summative evaluation.
Next slide.
And they covered the first one covered, the most recent one covered the campaign work that took place September of 2018 to April of 2019. So it doesn't include the summer projects we just shared, but we were excited that we got this independent evaluation that really showed some of the work that we've been doing. And we'll share that evaluation with all of you as well. There were a couple of observations, though, that we thought were important to point out. The first one was that the campaign really helped embed the quality rating and improvement system in Georgia as part of a statewide commitment to early learning.
Next slide.
You'll hear, just in our governor's race last year, the governor talked about the importance of the quality rating and improvement system. Legislators now talk about it all the time. There's an understanding that this is what we do in Georgia, that quality rated is important. You can go to the next slide. The next observation was that the campaign talks about how to build supply and then demand for quality rated options. At the very beginning, and we didn't really cover this today, at the very beginning of the campaign, we were trying to reach out to parents as the target audience, but we had not yet built supply for quality rated. So we went back and we realized first we needed to reach out to providers with kind of high touch meetings and some other work that we did before then reaching out to parents once we had more programs that were participating in quality rated. And so it shows that this is really an example of that. In addition, we promoted positive messaging throughout. All those pictures you saw about childcare as a mystery, they make you want to smile and laugh. It's not like terrible things will happen to your children if they go to poor quality care. It's more about the advantages of high quality care. And the evaluation found that that was really important as well. And you can go to the next slide. Another thing that's become motivating, particularly for providers who were perhaps slower to pick up the quality rated work, was that that the state has now mandated that by the end of 2020, any provider that wants to participate in our state's child care subsidy program must be quality rated. That, of course, has been a motivating factor in provider actions, and we're looking forward to continuing to see more and more providers in the next year become quality rated. You can go to the next slide. We talked about that peer-to-peer communication, especially the work that our CCR&R is doing with ambassadors. And we found that that's important in terms of the peer-to-peer relationship. Again, if you'll remember back to the very beginning of the presentation, the polling showed that parents trust other parents. So we used influencers, we used ambassadors, and we use direct communication to ensure that parents get information from people and parents that they trust. And then finally, we know that support and awareness still varies according to geography. And while we work to cover the whole state, we are continuing to focus now on particular places in the state that might need a little bit more engagement.
Next slide.
Sorry, that might need a little bit more engagement. And we're also looking at things like how public transportation might map to quality, because as we continue to talk to parents, that's one of the concerns that we hear. So this work doesn't stop. we'll continue to do this work, and certainly as we get closer and closer to that 2020 deadline, we'll pay specific attention to geography.
So those are the different observations. There's a lot more to dig into, and the full evaluation that, as Mindy said, will be shared with all of you. But having those evaluations done was a very lengthy process, but so worth it. I think it's a valuable resource for not only GEEARS, but also our state partners who can learn more from this campaign and also learn about the different stakeholders involved in the campaign. And I believe it's going to be a really powerful resource for all of you and for other partners across the nation. So that concludes our presentation.
So, Jonathan, is the best way for people to participate? Can they unmute and jump in to talk with Mindy and Vet, or is it mostly that we need to use the chat box or the question box?
Yeah, I suggest using the chat box or the Q&A box for comments and questions.
All right, thank you. So now's the time when you can think about something that you're interested in trying or ask Vet and Mindy for more detail. I really was thinking about the way, and I'll start, while you all get ready on your computers and type in some questions or ideas. We saw a couple of people saying that they use the banner approach and the collateral approach with providers. In some states, they might give them templates of the logo to use, or letters for their parents about what it means, or other collateral for the program to use when they're recruiting. I do see a question about paying influencers. If so, how much? And were influencers living or based in Georgia, or were they nationally located?
That's a great question. And yes, we did pay influencers for their posts. We worked with a local firm, so they really managed the payment and the negotiation, which I suggest, because for our event that we hosted this summer, we managed that ourselves, and that is quite the process. But their rate is based on their followership and their engagement rate. So if it's someone who has maybe 10,000 followers, that will be a lot less than someone who has 50,000 or 100,000 followers on Instagram.
I do want to also just say that using a local firm for the influencer piece for us was really important. We used a national firm when we did the messaging and when we did those PSAs and the beautiful pictures of the kids where childcare is a mystery, but they didn't necessarily know Georgia. And we didn't want to spend kind of our precious dollars on having them spend time getting to know Georgia. We wanted a local firm that knew the influencers and knew the geography and knew what would resonate in Georgia. So for the influencer piece of the campaign, we shifted gears and went with a local firm. And that, I think, was also, for us, a really important move at the time.
And the rest of that question, were influencers based in Georgia or from other places? All of our influencers live in Georgia, and they're from all parts of the state. We didn't just want people who live in Atlanta and were posting in Atlanta. We wanted people from North, East, South, and West Georgia who have followers in those areas as well.
Great, and you recruited them, just to be clear, through the firm, right? The firm went out
Correct.
And looked and found the folks. Okay, great.
Correct.
Can you give us a ball? Go ahead.
I was just going to say that we used the firm for those first 3 rounds that I mentioned, and for the event that we had just this summer, we did direct recruitment. So that's reaching out to them directly via email and negotiating their price, and then setting that up and having a contract with them just so they understand what we expect.
Can you give us a ballpark of your annual paid media budget? And if you don't want to,
when we
okay.
when we did the paid ads and the Google placements, that was through the firm. And that really ranged every month.
Right,
Yeah.
but the total, you remember the total, the total amount that we paid the firm for the whole campaign. So that was the recruitment, the working with the social media influencers, the focus groups, was about $75,000.
That is so helpful. Thank you.
Right, and that's much more cost-effective. That's much more cost-effective than the paid media we did at the beginning of the campaign. Now, a lot of that, as we showed, was pro bono, in-kind media that we got from Cox Communication and others. But had we paid for those PSAs, it would have been a lot more expensive.
Do you find that, like, foundations and philanthropy organizations feel like this is something, a short-term investment where they can see a return on the dollar, you know, that they're willing to get involved in financing or funding a campaign?
So we've had 2 foundations who have funded major parts of this campaign, the Whitehead Foundation here in Atlanta and Kellogg. But in both of those, I would not call it a short-term investment. They wanted to see how we would sustain the campaign over time, which is why that earned media and social media and the community partnerships become so important, right? It's very expensive to keep posting, to keep buying billboards or placing ads in a newspaper. That's important, I think, to create the first consumer awareness and some, like, visibility, but after that we had to find other ways to ensure that the campaign would be able to succeed even when the dollars run out.
And the benefit of using the influencers is that when people see posts from influencers or people that they follow on social media, they're more likely to remember it and talk about it with someone else versus just an ad that you might see while you're doing something else online, and you see it and it might register with your brain for a few seconds, but it's not something you'll necessarily remember and share with other people. But these influencer posts are things that people share in the moment, and they remember it later on when they're talking to someone else, because it's like you've been told that information by a friend.
I saw that you put a lot of thinking into, like, channel partner organizations like WIC and pediatricians, because this could be seen as a transitional audience you're marketing to, right? Parents of children birth to 5, and then the children grow up, and you've got a whole new group to market to. And WIC and pediatricians certainly are seeing the new children born and new people coming in either to the state or to needing childcare. So that seems like a very promising strategy to get them on board with your messaging and understanding what you're talking about too.
Right. That's also why those parent ambassadors continue to be so important, because they're out in the community constantly talking to parents. In addition, we know that, again, parents talk to other parents. So I don't know about most of you, but when I had infants, I talked to my friends who had kids who were 5, 6, and 7 and were older, wiser, and had been through the process. So using parents, again, in that way is important. We also want to empower the providers to be able to talk about the benefits of quality rated, so that when they market their program, when parents are going through their tours or looking at their websites, that they're also able to talk about the benefits of quality rated.
I know that we have a number of QRIS administrators and CCDF administrators. How does this type of a campaign relate to state websites about where to find childcare and where to look? You know, have you, are you related or talking to people inside the government about the relationship of this campaign to their work on consumer education and awareness?
Right. So as I said at the beginning, this is a partnership between GEEARS and our Georgia Department of Early Care and Learning. At almost every decision point, we've had our partners at the Department of Early Care and Learning at the table That's really important. We are not doing this alone. This is integrated. And the website, www.qualityrated.org, is the state website. It's not our website, it's their website. We are absolutely leading people to the website that the state runs.
That's great. That's terrific. Other questions from out in the ether there? Does anyone else, does this strike something that you're doing or that you're thinking about? Please type into the chat box other questions or thinking about this topic. It is a very complex topic. Do you do any, I know that I heard in one state that they would send legislators a note or an update about programs that had improved their quality and moved up in the quality rating system, so that they then had the information they needed to write about it in their newsletter, or help make people aware, or even send a congratulatory letter to the program. Have you gone a direct approach and that's all, those types of decisions are context-based, like within your state, what's going to work, what seems right at the right time within your state. Have you tried a direct approach with legislators like that, or is it more like aggregate data reaching out to all of them?
So we thought about just that, reaching out to legislators every time a center in their district had been rated, but really that's a heavy lift. That requires a lot more staffing than we have. But no, we do more of a direct approach, in that as you saw those maps of the legislative districts, we send those annually to legislators. We send them, we reach out to them and talk to them about what their district looks like. And again, we've also, when we have events in their areas, we invite them. So this summer, those two events that we had in Columbus and Athens, we had the state legislators from those particular districts, and actually those counties, come and join the tour of the centers and participate pretty, actively in those meetings. So we do a lot of direct outreach to legislators.
That's great. It made me think then about schools. Talk a little bit more about what you've done, to get school awareness up about it in their communities, because they obviously have a vested interest in having high quality early learning providers in their catchment area feeding into their school district, right?
That's a great question. And that hasn't been part of this campaign plan, but GEEARS, as an independent organization that works on early learning and school readiness, does a lot of outreach to school superintendents. And we actually have we did a whole project a couple of years ago that created a framework for school readiness and talked a lot about what school leaders could do, communities could do, the healthcare community. And then we had, I think, 5 different full-day retreats in various areas around the state where we brought together the early learning community with the K-12 community to talk about school readiness. And as we did that, we always talk about quality rated.
That's great.
We also got a question about how we developed the initial partnership between GEEARS and DeKalb. And again, some of that was timing. GEEARS was established in 2010, and we had a brand new governor that was elected at the very same time. He happened to appoint as commissioner of his Department of Early Care and Learning, and Georgia is somewhat unique in that we have a separate department for early care and learning that works on child care licensure and our Georgia pre-K program. It focuses mostly on kids birth to 5. It also runs our child care subsidy program, which of course goes through school-age children. But he appointed as his commissioner someone who happened to be a good friend of ours. He had had another role in state government before then. And from the very beginning, we worked with them on the quality rating and improvement system. Again, as I said, when we were established, that was one of our charges through the group that started us, was to work on a quality rating and improvement system, and the governor was similarly committed to that. Luckily, at the time, the Obama administration established the Race to the Top Early Learning Challenge Grant, and GEEARS sat at the table with our Department of Early Care and Learning when we wrote that first application. We did not get the first Race to the Top Early Learning Challenge Grant, but we did continue the work that we were doing to build the quality rating and improvement system, so that when the second round of grant applications came out, Georgia was very well positioned and got the second round of Race to the Top Early Learning Challenge grants. GEEARS actually even helped pay for the grant writer for the second round. And I think it's important, we really delineated roles from the very beginning. DECAL was always going to, and DECAL is the name of our Department of Early Care and Learning, they were always going to do the licensure, the inspections, create the system. We were going to be the public awareness arm. In addition, we brought in another organization, the Georgia Family Connection Partnership, that helped distribute the incentive grants that we provided. There were incentives so that every time in the early years, every time a provider got rated, they got an incentive package along with the rating. And our Georgia Family Connection Partnership helped distribute those around the state through volunteers. All three of our organizations, the state and the two private partners, together went to private foundations around the state. We wrote grants together, and we raised, as I said, in the end, almost $18 million to support those incentive packages. Georgia Family Connection Partnership also served as the fiscal agent for that those private donations.
That's really amazing work. Jonathan, can you go back to the very beginning where she showed the timeline? I don't think visually we got a chance to see that long enough that she's relating to while we work on some of these other questions. In terms of what was included, can you talk a little bit about what was included in the incentive packages?
Sure, that doesn't show up in the timeline, but the incentive packages actually changed over time as centers or programs gave us feedback. There was curriculum material, there were toys, there was playground equipment, there were books. At the very highest level, I think there were computers. But the packages were designed to help the providers get to the next tier of quality rating. And there were some options that they could choose at the time, and we worked with a company whose name is escaping me at the moment. I should know the name of the company to provide who gave us a little bit of a deal on the incentive packages.
You know, some states are finding that they're differentiating supports. Back a little bit more, yeah, you're almost there, I think, to the slide I was looking for, but that they're differentiating supports sometimes based on the level the program is in the quality improvement. There we go. The quality improvement. Yeah,
that's exactly what happened.
Yeah, okay, all right. And then those build as you've been in longer, you're needing or looking for different things. Often the first blush is kind of filling a gap you've had in purchasing and, you know, getting things just so in the facility, and then moving on to, you know, more sustainable things around professional learning and staff development and really engaging the families and practitioners in what do we need here to improve the setting, right? As in part of a CQI movement. So is there anything else you'd say? I appreciated this slide, this timeline of it's not a one and done effort, is it? Communication and building awareness about a big initiative like this, and this timeline really demonstrates that. Is there anything else that you'd call out specifically while we're looking at this?
In the first year before the campaign was officially launched in 2012, there was a whole lot of work that was done, right? It's not, you don't just launch a quality rating and improvement system. You have to decide on tier levels. You have to decide on, I mean, even the little logo with the little peach. We did a lot of polling and testing. We did a lot of polling and testing. You would see very different images that we don't have today. In the early years of the campaign, we talked about that children are only children once. The messaging wasn't quite as effective in the early years, again, because we weren't as clear on who our target audience was and on what we wanted them to do. And so when Vet talked about the measurements and how we measure the campaign later on in this presentation, that became really important. The other thing that I would say is that one of the challenges might have been, and I think we've overcome it over time, the more people know about quality rated, is we're only a 3-star system. So if you're used to a 5-star system for, say, hotels, it's hard for you to translate that 3 stars are quality or even that 2 stars are quality. So we've had to work on that a little bit, but the state didn't want to, we felt like the differentials were important. We feel like the way the three-tier system works really does differentiate quality. It also gives, because again, licensing is our floor. You cannot participate in quality rated till you are licensed. We think that the 3-star rating is appropriate. We also committed to providers from the very beginning, and we continue to do so, that we emphasize participation in being quality rated. We don't necessarily tell parents choose a 3-star center over a 1-star center, because we know that for parents there may be reasons, whether it's location or hours or price, that they're to choose that 1-star center. We also know that this is an improvement system, and so we want that 1-star center or program to be incentivized to continue to participate and continue going back and getting re-rated. And so I think there's as much an emphasis on the quality rated brand and what that means as there are on the actual ratings themselves.
I know that you talked, I'm going in a different angle now. I know that you talked originally about your materials being in English and Spanish. Have there been other things that you've thought about in terms of reaching out to all families and communities? And of course that, trusted person and ambassador program gets right to what you found initially from your search, from your survey, but you need ambassadors in all communities. And how do you work toward, messaging? Are Spanish and English the primary languages spoken in Georgia? Tell us a little bit about how you've thought of this.
Yes, they definitely are. And one thing that we didn't mention was most of our recent work in the past 2 or 3 years has been targeted, because the grant that we did receive from the Kellogg Foundation was proposed with the intention to target specific communities in our state. And we really wanted to reach families living in low-income communities and help them to not only be aware of quality rated and understand the importance of high quality early learning, but also to be able to demand and participate in this program. So we've been very targeted in our approach in terms of geography. We have a set of zip codes that we use when we're targeting advertisements online, but also when we're targeting things in person and events around the state. We know which communities we're trying to reach based on what we set out to do with this grant proposal and the work that we've been achieving over the last few years.
Does anything happen with differentiating the messages on within communities, not only linguistically, but what a local community is interested in hearing about, or, have you found anything else along those lines that informs next steps for you, especially with that, Kellogg grant that was focused on low-income neighborhoods?
Yeah, I think that we've been clear to try to keep the message consistent, and that's been a big piece of what's helped us be successful is that people are talking about quality rated in the same way. All of our partners, all of the stakeholders in this work, and our audience understands it in the same way, but we have been very strategic in the methods we've delivered those messages. So we know that for some parts of the state, we should be using radio advertisements because most of the people in that part of the state are listening to the radio. But in other parts of the state, we'll use Facebook advertisements, knowing that most of those families are on Facebook. And we know that in Atlanta, a lot of families are on Instagram and just accessing everything from their phones, not necessarily from a desktop computer. We're also aware that some families in our state don't have access to internet at their home, so they're receiving information from other ways. So we have been sure to understand how people receive information in different parts of the state, and that was part of some of the surveys that we did in 2015 and 2017, but the messaging has been consistent across all communities.
That is so helpful. Thanks for sharing that and spelling it out so clearly. And where do you get information like that? Like, how did you find out? Just the surveys that you did, or you didn't? Did you purchase that information somewhere? Like, how do you find that out?
In some places, earlier on, we did purchase some of that information. So again, as we've said, we've used in both cases communications firms to help us with much of this work. And the communications firms have purchased some of that information along the way. In addition, some of that is the polling that we do with families, the conversations we have with families, and frankly, partners who are out in the communities doing the work.
And some of it comes from our data tools that we have at GEEARS and online. We have a suite of data tools that we use that measures many of those metrics, so we know what the third grade reading levels are in different counties around the state, and we can really go down to a census tract level for a lot of our data, so that's really informed a lot of our work as well. And we've collaborated with the state on the data that they have on providers, on quality rated, and also on families, especially the families that are participating in our subsidy program that's called CAPS, Child Care and Parent Services Program. So using all of that data strategically has helped us to make many of these decisions.
Well, I know that everybody is probably anxious to open up this evaluation report that you did, and I just think that it's so important. It seems so straightforward, but to say that you're evaluating the success of the campaign and what you're finding. And I think that sometimes we leave communication, to the last moment, or it's not part of a campaign or a detailed strategy. And I think with such careful thinking and decision making, you guys have gotten a terrific result from all your hard work on this, and appreciate so much you coming and sharing this with our group today. I don't see any other questions, but I just would like to say, Vet and Mindy, do you have something in closing that you feel to wrap it up, or that you'd want to say to bring us to closure here?
So from the very beginning, communications was a part of the Quality Rating and Improvement campaign in Georgia. And I think that that's important. It's not enough to improve quality if families don't know how to choose quality, and if providers aren't incentivized to participate. And so it has been a great opportunity for us to learn along the way. It's actually improved, and a lot of the tools that we've used have been embedded in all the work that we do in early learning now in Georgia. It's also shown us again and again the value of partnerships, both with the state and with community people on the ground. And it's been a lot of fun. So it's, for us as the private partner, really been a pleasure to do this work and learn from lots of folks just like those of you on the call who work in this field every day and know this work, and it's been a privilege for us to do it.
Vet, anything else, or are you good?
That was great. I echo everything Mindy just said. It's been an honor to work on this. We hope that people can learn from it and see the same type of success around the nation.
Well, thank you so much for sharing with our participants today, and I'm looking forward to advertising this session in our e-news because I think it's just been terrific information and sharing a real important state story. And thanks to everybody for coming today and for your good questions, and we'll talk to you again soon. Goodbye.